participants from around the world. I'm Fleur Bickford, Program Director and MC for Gold Learning. I'm chatting today with Dr. Alison Hazelbaker about her upcoming presentation titled Game Changers, New Studies That Will Change the Way We Think About Tongue Tie, which she will be presenting as part of our Gold Learning online symposium, Tongue Tie Research and Implications. So Alison, welcome, and thank you for being with us today.
Oh, I'm glad to be back, and I think we're going to have fun with this particular topic.
I think so too. I'm really looking forward to this one. So before we talk about your presentation, how about you tell us a little bit more about yourself, because you literally wrote the book on tongue tie. So perhaps you can tell us a little bit about why this became such an area of passion for you.
Well, I knew nothing about tongue tie until I was in my mid-30s, and I was in my master's degree program, and my mentor, Shelley Marmette, who is one of the very first lactation consultants in the world, had us go around the room and open our mouths and move our tongues around, etc., and I was the one in the room who was tongue-tied. And that was like a big shocker to me, because I was like going, what? And how? And why? And what does this mean? I shortly was pregnant from then, was pregnant. It wasn't the class that made me get pregnant, but I was pregnant with my fourth kid, and he was born, and he was also tongue-tied. So that really sparked a keen interest in the subject matter. He fortunately was clipped before he was 24 hours of age, and then when my fifth baby came along, he was also tongue-tied. So in my master's degree program, I decided that because there was a lack of scientific study on the subject, and because it appeared as if this was truly a keen problem, I decided to do my master's thesis on this, and I developed the assessment tool for lingual frenulum function during that program. That was in the late 1980s. I also did, alongside of that, the first prospective study on the impact of tongue tie on breastfeeding, and did a pre and post frenotomy. I had a small sample size, but nevertheless the results were significant. So that's really how it all began for me.
Okay, interesting. I think it's really interesting how many of us kind of come to have an interest in tongue tie through our own personal experiences. I know for me it was kind of the same. As I was studying to become a lactation consultant, I was reading about tongue tie, and I was like, oh, I'm going to go look in the mirror and see what a normal tongue looks like. And I looked in the mirror and went, oh, look at that, I'm tongue-tied. And I think I was 33 at the time, and I had no idea. And my mom had no idea, but it explained a lot of the issues that my mom had when I was a baby. Heard all kinds of stories.
Yeah, absolutely. I'll bet.
Yeah, at the same time I realized that both of my kids were tongue-tied as well. So it's interesting, but I'm, not glad that you had that experience, but I'm glad that it triggered your passion in this, because you've really had so much to contribute to all of this. And because of that, I am really excited to hear about what can we expect from you in the near future. What are you working on now?
I'm working on two research studies. One is a survey, the other is a reliability study. I'm kind of getting tired of people citing the AMIR study and pronouncing the ATLIF unreliable when there were several other reliability studies. So I figured I probably ought to do one myself. So that's in the planning stages. I am working, finishing up the tongue tie and lip tie laser frenectomy book with my co-authors, Marty Kaplan, Bob Convasar, and Peter Vitrick. And I'm getting ready to put together a guide on tongue tie for parents. So I got a full plate right now, and so that's what people can expect to see happening over the next couple years.
Oh, that's exciting. You certainly do have a full plate at the moment, but some really exciting stuff to look forward to from you, so that's fantastic. So let's talk a little bit about your presentation that's coming up. Perhaps you can tell us just a little bit about what you're going to be covering in the presentation and what you hope delegates will be able to take away from your talk.
Well, the last few years in science relative to tongue tie has been really exciting. We went through a period where, yeah, there were a lot of research studies done, but they weren't really contributing a whole lot to our understanding of the phenomena. They were just sort of repeating, the same stuff over and over again. Yes, post-phrenology, mother's sore nipples went away. Not that that's not important, but it kind of, from a scientist's perspective, gets a little bit boring. So the studies that I'm presenting here, some of them are new, some of them are old, but I considered them to be game changers. They are presenting evidence that is going to really change the way we talk about tongue tie and lip tie and help us to delve deeper into the subject matter, and I think these studies are going to affect our clinical practice as well.
Okay, thank you so much, Allison. I am so excited for your presentation. And for our delegates who are listening, I know that you're excited too to hear more from Allison, and you will be able to hear lots more during her presentation titled Game Changers, Studies That Change the Way We Think About Tongue Tie and Lip Tie, which is coming up live on Tuesday, November 15th. And Allison will be presenting at 2 o'clock PST or 5 o'clock EST. So we hope to see you then. Thanks so much for joining, everyone. Goodbye for now.